Okay, doctor. Hello, we are starting now. So I want to say hi. So we are starting now. I want to say thank you to everyone for joining us wherever you are from. Thank you. Good evening and good afternoon from anywhere you are joining from. Welcome to Chat4health live chats on radio and web. This platform is a place that everyone can get real answer about their sexual and reproductive health, preventing belle by choice, infection treatment and care and support. So today we are going to discuss a very important topic. We said knowing your HIV status, preventing staphylococcus among young women, among young people. Part 2. So before we proceed, we'd like to say a big thank you to our partners, those that make this program to move on. KWDF, PEFA Nigeria, Movement for Women Alliance, Active Youth for Africa. Thank you so much for your support. So today we are not going to discuss alone. Last week, we're talking about, and we have a doctor and nurse in our midst that was telling us about Staph, how we can prevent. So today we also have a doctor in our midst that is going to discuss more and tell us how we can prevent Staph in our life. So before we proceed, I would like to briefly greet his bio. Dr. Homfa Muzia, a dedicated and accomplished medical professional. Dr. Homfa Muzia is a registrar specializing in psychiatry, driven by a passion for delivering exceptional patient care and advancing the field of mental health. Holding an MBCHB degree from Sefa Mercado Health Sciences University. Dr. Muzia has further enhanced her expertise with a diploma in mental health from the College of Medicine of South Africa and a postgraduate diploma in advanced clinical psychiatry from the University of South Wales, UK. Academic excellence has been recognized with the prestigious Mark Foundation Scholarship 2022. Welcome, Doctor. Hello, Doctor. Can you say hi to us?
Thank you for the wonderful introduction and warm welcome. And hi to everyone.
You're welcome, ma. Nice having you here.
Thank you.
Welcome, ma. So we are going to start. So our first question we have here: what does food poisoning mean, and how can that be prevented? So, Doctor, over to you now.
Thank you very much. This is a very interesting topic, considering that food poisoning is a rising global public health concern. However, food poisoning is something that occurs when someone consumes food or drinks that are contaminated with harmful bacteria, viruses, and other pathogens. So this can be prevented by handling the food safely, washing hands, utensils, and surfaces frequently, making sure that the food that you eat is cooked thoroughly and heated to the recommended internal temperature. Also, storing food properly can help prevent food poisoning. It means that foods that are perishable must be refrigerated promptly, and raw meat and poultry must be put separately, as well as for seafood. You also need to make sure that you avoid cross-contamination, separate raw meat poultry, seafood from foods that are ready to eat. Also, it's important to choose safe food source. So it's important that people buy food from reputable suppliers and check the expiry date on food items that are pre-packaged. Thank you.
Thank you so much, Doctor, for that wonderful presentation. So we are going to move to another topic, another question. Who is at risk of a staph infection?
Oh, thank you. So, people who are at risk for a staph infection include people who have weak immune systems, those who have chronic illnesses, or they are taking medication that suppresses the immune system. Also, participating athletes in contact sports, they are at risk of constructing staphylococcus infections, as well as individuals who have skin conditions such as eczema and acne. They are more prone to getting staph infections. And also people who live with invasive medical devices such as catheters and implants, those can predispose them to developing a staphylococcal infection.
All right, thank you so much.
Okay, Madam Esther, please. Thank you, Doctor. I would like to ask question concerning the first question that you answered, food poisoning. Does food poisoning cause staph?
So remember I mentioned that food poisoning is by food that has been contaminated. So one of the bacteria that may contaminate food include staphylococcus. Although it's not only staphylococcus that causes food poisoning, there are also other viruses, fungi, and other pathogens that may also cause food poisoning. So it's not limited to staphylococcus only. So you can have.
I would also like to understand, is it like one of the method of contacting the staph? The poison food, is it one of the method of contacting the staph?
Staphylococcus is one of the causes of food poisoning.
Okay.
Yes.
All right. Thank you, Doctor.
You're welcome.
Okay, Doctor.
You are muted, Madam Esther.
Oh, Doctor, thank you so much. So we'll move to the next question. How to prevent the spread of staph skin infection?
Oh, thank you for that question. Number one, it's important for people to make sure that they practice good hygiene. It means that you wash your hands frequently, especially after touching infected areas, before preparing food items, coming from bathrooms, and also from handling things in the gardens. And then if you have wounds, you make sure that you keep them clean and covered. You apply an antibiotic ointment if available and cover it with bandage. And then you need to avoid sharing. I think someone is asking me if they can present my, yes, I had sent a presentation. I just didn't know how I should share it, where I had put a bit of these answers. Yes, please share the presentation.
Okay, thank you.
You're welcome. So I was saying, also avoid sharing personal items such as towels, razor blades, and athletic equipment, as those things
Madam Esther, can you please present a presentation? Share it on the screen.
I'm coming.
Should I continue in the meantime or wait for it?
Yeah, yes, continue, Doctor.
Okay, no problem. I was saying you avoid sharing personal items because those things can also transmit the staphylococcus from one individual to another individual. And then it's also very important that after exercising, you shower. especially after contact sports. Also, if you exercise in a gym, that can be an area of contact with Staphylococcus. So if you shower immediately after, you are able to let the bacteria wear off before it thoroughly contaminates other parts of the body and lead to skin infections. Thank you.
Okay, doctor. Thank you, doctor. I would like to know, does it have cure?
Yes, there is cure for Staphylococcus aureus. Remember, it is a bacteria. So we have antibiotics that are targeted towards its cells. Although, if the antibiotics are not used accurately, one can develop resistance to the antibiotics. Then we would need to go higher up in the classes of antibiotics to use those that will be specific to the antibiotic, to the resistance developed to Staphylococcus. We have methicillin-resistant Staphylococcus, which does not respond to the typical antibiotics.
Okay, doctor.
Yes.
Yeah, a woman has the question that she has been making use of a lot of antibiotics for her staff, but sometimes the thing will come and it will still go and it will come gradually. So what can she use to prevent it?
To prevent?
Yeah, like
this is someone who's already having the infection and they've been using a lot of antibiotics. So I don't think they are at a level of preventing, but they can prevent infecting other members of the family by making sure that they practice safe hygiene, they wash their hands, make sure that when they prepare food, it's cleaned up, and they make sure that they shower after exercising, and also not to share personal items with other people. Then they will prevent the spread. But because they already have the infection, for them, we would need to treat. If it's not responding to antibiotics, we want to know if she is taking the antibiotics as prescribed. Is it the correct dose? Is she taking it the number of times that was prescribed? If we find that, yes, it's adequate how she's taking it, then we could be looking at a picture of resistance, or the cause of the food poisoning that she's experiencing is not related to bacteria. So we might end up having to do cultures from her stool. We take a sample of the stool, we take it to the laboratory, and we check which organisms are in there, because we might be looking for the wrong offending agent.
All right, can you see my screen?
Yes, I can see your screen. It's on the food poisoning slide.
Okay. Okay. Then who is at risk? I think you answered the question.
Yes, I've answered the one of the people at risk.
Okay, prevention of staph infection. That is where we are.
Yes, we were just highlighting that one.
Okay. Can you talk on prevention?
Sorry?
I said, someone said, how can she prevent herself from the staph?
So to prevent herself from the skin infections, it's this practices. She had said it's someone who has had them and has been using antibiotics. So it's the one I was saying that because she's already having it, she can prevent it for the others in the family to not get it by practicing good hygiene, making sure that if she has any wounds, she keeps them clean and covered, and not sharing her personal items with the other people, because the Staphylococcus can harbor in personal items such as towels, razor blades, and athletic equipment. And to also make sure that if she exercises, she showers immediately after exercising to avoid cross-contamination.
All right, thank you so much, doctor. The symptom of staph infection, doctor, can you shed more light on it?
So the symptoms of Staphylococcus infections, one will notice some redness, swelling, and pain around the infected area. There may be pus draining out of the area or some discharge, which may vary in color. They may have a fever, that's an elevated temperature, and they may have chills, and they may also have fatigue associated with the swelling, redness, and pain around an infected area. This will point to say there could be a potential Staphylococcus infection.
All right, thank you so much. So, doctor, if unfortunately someone does not take any antibiotics,
Yes.
are you with me?
Yes.
Maybe the person does not know that this is a staph, then it does not even bother to take any antibiotics. Would that have any side effects?
Yes, there are various complications that can develop from a long-standing staphylococcal infection. Let's say if this person, what they have is a staphylococcus infection, but they did not know that it's a staphylococcus infection. It can lead to an abscess or a boil on that area that is infected. It may cause cellulitis of even at the extended area around the small area where it was. It may now affect a bigger area and cause cellulitis. It may also, in severe cases, lead to endocarditis. This is an infection that now affects the heart. So it means that that infection is now affecting the heart and may also be life-threatening. It may also cause osteomyelitis. This is when now the infection infiltrates into the bones. So they now have a bone infection. And it may also cause sepsis, which is an infection in the blood, which may also affect all other systems as the blood is now also infected.
Okay, doctor. Does it mean that someone can contact it through sex, right?
Staphylococcus, yes, through sexual contact. Remember, this is also tissue contact. This is also a tissue exchange between two individuals. So it would be possible that if one individual has staphylococcus within their intimate areas, they can pass it on to their sexual partners.
Okay.
Yes.
Okay, thank you so much. So what about like a woman that does not know? Okay, that means she knows and she has been taking the treatment. Then unfortunately, the treatment does not like receive the staff does not receive the treatment. Can she go to hospital, or where did you want her to go, and what did you want her to take?
Okay, so if this is a woman who has been on treatment, but it seems that it's not going away,
Exactly.
I would recommend, I don't know about how the referral system works your side, but with my side, if they've been treated, we'll assume they started at a clinic, and that's where they got their first batch of antibiotics. So they would go back and report that it did not work. That's where they will now be referred to a hospital, and further investigations will be made to say what is the reason that this patient is not improving despite being on antibiotics. Then from there, that's where we will take it on from the investigations that are done, and they can be taken onto another class of antibiotics that is different from the one they were not responding to, as we wait for the results. So it depends on what kind of staph this is. If it's one that there is no visible lesion, it means we are not going to take from that lesion. If we can take from the blood can also show us if there is an infection. So if there is a visible lesion, you biopsy that lesion, you take a swab, and you take that sample to the lab. They are also able to identify what organisms could be causing the problem.
All right, thank you. Okay, what about the invisible stuff? Hello,
So
doctor.
yes,
The invisible stuff. How
the
can someone?
invisible stuff.
Yeah.
So this is someone who might be living their day to day without anything they can identify on their body that they have staphylococcus. It may be identified maybe by partners when they come into contact with them. They now become sick or develop some symptoms after being with them, although the person they got the contact from doesn't have it. It may also be an incidental finding when they're just doing other routine bloods and find that their inflammatory markers are high. And then that's where we will now want to investigate where is the root cause of this infection.
Okay, thank you so much. Doctor, you said the invisibles, then someone can ask to go for tests, right?
Yes.
All right, thank you so much. Then what are the symptoms of the invisible?
So symptoms of the invisible will most likely be fatigue related. The person may have a elevated appetite. They are non-specific to staphylococcus. They won't immediately shout staphylococcus. The fatigue, one might come up with a list of many reasons why they think they are fatigued. Only to find out later that it's actually because of a staphylococcus infection. They may have headaches. They may just have stomach upsets. They may have just generalized body weakness. There's also malaise, which is a feeling of being unwell, but being unable to point where the problem is. Those things could be some of the symptoms of staphylococcus infection that is not visible on the skin or anywhere in systematically.
All right, thank you so much, doctor. I really clear with your explanation. Thank you so much. Now, the last question now, what are the complications of staph infection, the complication?
So the complications, these are systematic. A patient may develop an abscess or boils on various parts of the body. They can develop cellulitis. This is a skin infection. They may develop endocarditis, which is a heart infection, which can be life-threatening if untreated, can lead to sudden death and other myocardial infarctions. This can also lead to osteomyelitis, which is a bone infection. Means that the infection now migrates from the skin and penetrates into the bone. And this can also lead to sepsis, which is a blood infection. So because the blood circulates through the whole body, it's also quite life-threatening because it circulates to all other organs and may lead to mortality. Hello?
Yeah, thank you so much, doctor. It's question time. Thank you so much. Madam Esther, do you have any question?
No, I don't have.
All right, thank you very much. Thank you so much. I just want to say big thank you to doctor for more explanation on Staph today. So I just want to use this opportunity to tell everybody out there, young women and girl men, Muna, go to healthcare center or any place, Muna go check una health, because doctor make me to understand today that there is what they call invisible staph, and that is the only thing that you can, sometimes you feel headache, sometimes you feel weakness, sometimes you feel like you are feeling so, your body will be feeling somehow on your health, and you don't know wetin dey cause am. You go say, wetin come dey worry me? I dey feel headache every time, I dey feel body weakness, stomach pain, stomach upset. So now we don come, doctor don tell una say, make una no dey sit down when you feel all those things. Make we dey stand up, waka, go to any healthcare center, go and check your body, go and do test to know which kind of sickness, which kind of bacteria wey dey for your body. Is it staph? Is it invisible staph? Is it physical? Because already explained to us that this type of the thing, the symptom where you go get na boil, and no be all of them they come like boil. Some of them, because sometimes might be the food where we chop can cause this stuff. Sometimes might be maybe the environment where we stay, the maybe the place or any place where we dey where no dey clean. So doctor don't tell us, say, make we know they sit down. Sometimes it will come like boys, sometimes that place would they come like red, like anyhow. So doctor don't tell us, say, may we stand up, may we go to healthcare center, go do test to know if you see boil for your body, go do test. No say na malaria, I go take a bow, I go do this one. Say may we work out, they go do test to know maybe this one na staph or this one na infection, because this staph na infection they say in be. So thank you for everyone. Thank you for joining us today. Thank you for staying with us. Chat for Health. Are you a woman with unmet sexual and reproductive health needs? I beg, Chat for Health, they dear for you. You can call our WhatsApp number 08069423539 or 07048065450. We dey there for you. You can call us anytime, any hour. We dey there. Please subscribe, share to your friends, share to your brother. Everybody need health. Health is our priority. We no go dey sit down the things say me I dey fine, but in other hand you no dey fine. So you need to know wetin dey for your body. HIV is real, then staph is also real. So may we stand up to check for our health. Stay tuned for next week. By this time, we are going to hold again. Thank you, Dr. Muzia.
Thank you.
Thank you so much for joining us today. We are very proud to have you in our midst and looking forward to have you again next week. Thank you so much. Thank you. Yeah.
Bye.
Yeah. Bye for now.